Hi guys, I'm back with another video. I saw some comments on my last post asking what ISBAR is, so I thought I'd just dedicate this one to kind of going into an explanation and maybe do an example so that y'all understand it better. So ISBAR is an acronym that outlines a specific way of giving information to your patient or about your patients to someone who's on their care team. It just makes sure that you include all the relevant information and can help keep you from making mistakes. So ISBAR stands for Introduction, Situation, Background, Assessment, Recommendation, and Readback. So in a minute, I'll give an example of an ISBAR just to help you understand kind of how it would flow better. So you'd start with the I, the Hi, my name's Addison. I'm the nurse taking care of Mr. So-and-so today. For the sake of this, I'll use Mr. Todd. So next would be the S, it's the situation. He's not in any pain or discomfort, but I did notice some JVD and plus two pitting edema on both ankles whenever I was doing his assessment. He came in this morning saying that he noticed a 5 pound weight gain within the last week and was told by a previous provider that if that were to happen, he should come in to get checked out. Um, his history is of hypertension, type 2 diabetes, and he said that he did have an MI last year. He lives with his wife and said that he recently quit drinking, but he's been smoking a pack of cigarettes for the last 30 years, basically every day. So for my assessment, he is alert and oriented times four. His pupils are equal, round, reactive to light. Um, he has no weakness or difficulty with movement. Um, His heart rate, his heart rate's 110, his blood pressure is 100 over 68. His peripheral pulses are a little bit diminished. They're just a little bit weak, but they're not, I can still feel all of them. He does have a present S3 sound whenever I listen to his heart sounds, and he also had bilateral crackles in both of the lower lobes of his lungs. His O2 sat is 92% on room air. And he says that he's not having any difficulty breathing, but I can still hear those lung sounds whenever I listen to it. His stomach, the sounds are normoactive, but it's descended with ascites. He says that he's not having any stomach pain right now, which is good. But he did say that he hadn't had a bowel movement for the last 3 days. For GU, um, he's only had like output of maybe like 300 ml since he got here, which was around 8 hours ago. And it's clear, but it is a urine, amber color. So he seems to be retaining a lot of water. So my recommendation would be to maybe see if we can start him on a diuretic if that's good. And then also maybe to start him on some oxygen on nasal cannula just to see if we can get that up a little bit more. Um, so also in an actual ISBAR, the next R stands for readback. So if the provider did end up prescribing something over the phone or giving me something to do after I gave the assessment, I would say it back to him or her just to make sure that I completely understood the instructions being given to me. And that just helps keep you from making any med errors because you didn't understand or didn't get the full picture of what you were supposed to be doing. So thank you guys so much for watching. That's my little demonstration of an IS bar. Let me know in the comments if you have any questions.